agenda today. We have our main room presentation. So Katherine will be leading most of that presentation, but I'll be dipping into a few slides there as well. And then we break out into our discussions at 9:55. So we have like 40 minutes for that individual room discussion breakout, and then we come back to the main room to feedback, and then we'll have a kind of a brief summary, and then we'll close at 11 o'clock. So today, as I've indicated, we really want to gain your views on how we can improve how we gather feedback from staff across health and social care, with a focus on those more likely to face inequalities in the workplace. I think this is over to you now, Katherine. Thank you.
Yeah, hi. I'm going to try and speak very briefly, because I don't want to go over time, about the new single assessment framework, what the staff experience framework is, and how that sits in the single assessment framework. So I think it would be just helpful briefly to go over how our future kind of model relates to what we've been doing over the past 8 years. And there's some examples here of things that could feel different. So on the left-hand side of the screen, you'll see how things are now, and on the right is how we want things to work in future. So at the moment, we have 3 different frameworks for registration health and adult social care, covering the 5 key questions. They duplicate a lot of stuff across the CLOEs, key lines of inquiry, and are not kind of as relevant as they were as when we brought them in kind of 8 years ago. In the future, you'll see on the right-hand side, we want to move towards a single assessment framework that will cover all sectors, services and levels. And we hope this will simplify things greatly for providers and CQC. What we look at won't change significantly, but how we do it will hopefully feel very different. So on the next line, you can see our intended assessment approach. At the moment, we have separate monitor, inspect and rate steps, and we inspect at a set point in time based mainly on the previous rating of the trust or service. In the future, we want to move away from these separate monitor, inspect and rate steps, and instead we'll use information we receive, collect and analyse to assess providers more frequently without being tied to set dates. This information will come from multiple sources and be gathered in a variety of ways, and it will basically mean that our assessments are a more dynamic process, and that we're able to make better regulatory decisions. On the next line, the third one down, you can see at the moment, we mainly gather evidence on sites and make judgments against the rating characteristics and key ratings that aggregate and give us a key question. Oh, I think I've skipped one, sorry. We're on the 4th line. And in the future, we want to be more consistent and just transparent in our approach and how we make judgments on quality. We want ratings to better reflect the care that people actually receive, and we want to be clear about where a provider or service sits within a rating. So we're developing a way to categorise and score evidence as part of our ongoing assessments. And in terms of the reporting, which is the bottom line, at the moment, we publish very long PDF reports that are not very accessible and take a lot of time for us to write and for people to read. And in the future, we want to move away from these longer reports. And we know they don't really work and they're not really fit for purpose. They're inaccessible. And they take up a lot of time for CQC inspectors as well, for them to produce them. We want to have a more up-to-date view of service quality, and we want to streamline the reporting process and the publication of reports to make them shorter and more tailored to the audiences that read and use them. So that's kind of a brief whistle-stop tour of kind of now and in the future. This kind of briefly speaks to the timelines around the implementation of the single assessment framework. So at the moment, just this week actually, operations have moved into their new teams. So there'll be no changes at the moment for current relationships with CQC. We're still building and testing our new way of working. We're making sure the technology and the new approach is ready for later on in the year. And in the spring, from now, we're also starting to look at stuff at a systems level. So you may have seen published our kind of interim approach to ICS, integrated care system and local authority assessments. And in the summer, we'll be kind of testing and continue to test and embed elements of our new approach. The provider portal will go live, and we'll start doing things through there, such as notifications and some elements of enforcement. And from late 2023, we'll start assessing using the new approach, including registration and assessment. Providers will have all gone over to the new provider portal, and you will be interacting with CQC's new operational team. So those are kind of some of the broad timelines. So this kind of gives an overview of the single assessment framework, which I'll go into some of the detail in the next slides. But basically, it will cover our regulation of providers, local authorities and systems, focus on what matters to people who use health and social care, and it will provide an up-to-date and accurate view of quality. We want to make things simpler so we can focus on what really matters to people, as I alluded to before. We want to better reflect how care is actually delivered by different types of service, as well as across local areas. We need one framework that connects our registration activity to our assessments of quality. So I'll go on in the next slide to talk about the quality statements, which are one element. So the quality statements are being introduced, and they're pitched at the level of goods and linked to our regulations, and they'll help us make judgments about the quality of care. They're going to replace the old key lines of inquiries and prompts, and they're expressed as we statements, helping to make things clear for providers about our expectations while reducing duplication that currently exists across the key lines of inquiry. So they're centred around key topics across the key questions. So the key questions, safe, effective, caring, responsive and well-led, remain in place. But we now have these quality statements sitting underneath them. And we'll use this set of statements in our assessments of all sectors and service types and of all levels, using them to register services, as well as look at local authorities and integrated care systems. And these are the basis for our single assessment framework. And just here on the slide, you can see that under well-led, there's now a specific quality statement that focuses on workforce equality, diversity and inclusion. So that's one of the main places that we're looking to gather evidence. But as you'll see in the next slide, please, Sam, there are different offering categories, and feedback from staff and leaders is one of these, and it's a required evidence category for all of the quality statements. So as well as for that specific quality statement in well-led, we want to gather feedback from staff better across all of the quality statements. And the other evidence categories are people's experience, feedback from partners, observation, processes and outcomes. But for today, we're focusing mainly on feedback from staff and leaders. And this is where the staff experience framework comes in. So we recognise that people who work for health and care services are the best source of evidence about what it's like to work for a provider. And we want to get better at listening to members of staff across health and social care, especially those who may experience greater workforce inequality. The staff experience framework is intended to be quite a high-level document that will set out how CQC will do this and how we will use the experiences in our regulatory work. And underneath that framework, we'll have tools and guidance to operationalise the principles. So it's kind of a stepped process, but we're focusing kind of on the high-level principles of what you would like to see us get better at, essentially. We need your help to ensure the voices of frontline staff more likely to experience workforce inequality are central to the development of the framework. We did send out a Citizen Lab survey last year to get some initial feedback, but we want to continue to engage with staff. And this is the first engagement session that we've held about this, and yeah, it's the first type that we've tried at this level. So hopefully it goes well and we can build on it. I'm now going to pass back over to Helen for the next slide.
Thank you, Katherine. So many of you will be aware of the employment tribunal case that was brought and the successful challenge by Mr. Kumar in his experience of employment at CQC. And what we have done quite rightly in the wake of that employment tribunal case is to review a whole range of issues within CQC that have related to the case itself. And what we've done is that we have now published our review in light of that, which we've called the Listening, Learning, Responding to Concerns Review. And the review acknowledges how much work that we have to do in this area, where we are responding to concerns that staff raise with us, that people raise with us, and how, you know, we are committed to making sure that we improve in this area. And the review does give us opportunities to be able to do this, to make things better, to include how we listen and respond to staff raising concerns, and also how we think about equality within that. The staff experience framework development is going to be a really important tool going forward. So now, more important than ever, that we have your views, and that's why this workshop is such an important part of you know, that development process, really. Thank you. But basically, in your breakout rooms, we want you to discuss these 3 questions. So, are there any barriers to you sharing feedback about working for your provider with CQC, and thinking about how these could be overcome? Second question, how we can get better at speaking to you and your colleagues outside of an on-site inspection, site visits. And are there specific areas you think we need to be very focused on to ask when we talk to you about your experience of working in your trust, particularly in relation to workforce equality issues? So, are there any questions that you have in terms of any? I'm just wondering if there's any questions in the chat, actually. So
we have one question, yes, in the chat, Helen.
Yeah, can it be clear as to what aspects of the previous framework that was considered unhelpful? That's a good question. Katherine.
So I think we recognise that traditionally in the older model, in the current model, we weren't as focused on people using services and the views of staff as we could be. So that's something that we've really taken forward into the new model. So there's a similar piece of work called the People's Experience Framework. It's about centering the voices of people using services, and just generally building on the strategy. So the aims of the strategy are to improve the way we look at systems and to focus on reducing health inequalities. And there's kind of strands in that speak to kind of centering the voices of people more. So that's, I guess, what I was alluding to with the development of this work. I don't know if that answers your question.
Thanks, Katherine.